I think, Paul, you sharing about some of the way things were before and the metaphor that you used, I thought was really helpful.
Yeah, so, if anyone's been a part of building a house or had a loved one going through that, you'll know that one of the key players in that is the actual builder. And so what the builder is able to do is work with subcontractors and kind of triage they know what the finished goal is, but the weather could get in the way, permits can get in the way. There are all these things that you need someone that's kind of sequencing and making sure that things that when they laid the tile, that the tile was laid properly, all those things. But the way in Arkansas, and many of my friends from other states say that it's the same there, but our referral system, especially for folks that are in crisis, is just atrocious. And so it's not that we necessarily, I've been a part of creating many new programs. But I think that what we need in Arkansas, and you may need in your own state, is first we need to be able to make the programs that are out there that are needed by target clientele, folks in the child welfare system. There are counselors and housing authorities and food programs, and all those things are there, but they do not work well together. It's akin to trying to build your house by buying some blueprints and picking your subcontractors and emailing them the blueprints and telling them to get after it. And the very next day, the roofer shows up and you've not even broken ground. This is the way that, at least in Arkansas, folks in crisis access social services. They're not really sure what you offer. You're running a retail shop. They walk in the DWS office. They can't pass a drug test. They got a ride there. They don't have they've got no skills, but they're sick and tired of being broke. And they're saying, help me. And the people in that office will onboard them into a program, but they know that they're not going to be, I can't send you to truck driving school right now. You need to be able to pass a drug test. No one's going to put you behind the wheel of a truck, right? You're couch surfing, right? You can't even think. The tyranny of the moment is so present in your life that you're unable to engage in abstract thought. And so you need to be able to sequence these things. And so that's what we set out to do. And it's now working in several different communities. After several years, building the first one was the hardest thing for us. And so we were running some reentry programs. We were trying to engage in bigger ways and trying to help biological families. But then we finally, just one day, we were getting our rear ends kicked in Fort Smith. We had, in 2017, 1 in 34 children in Sebastian County, Arkansas were in foster care. We had a 45%, I think it was 45. It was above 40. I think it reached 45% conviction to incarceration ratio. And we were over 90% free reduced lunch in the schools there. It was just a really bad time. Opioid crisis first entered Arkansas through those counties. So we launched 100 families. And how that came about is, one, is it couldn't be called Restore Hope, even though we were acting as a backbone, because that would have made it about us. And it needed to be about the community. The community needed to own a project in which we were a player. We were the backbone player, but we were just a player. And so we said, can we at least get together? Because y'all are all irritating everyone, all you people out there. Collaboration is hard. And if you don't think it's hard, you're the hard one in the mix. Everyone's talking about you. And so we were sitting at the University of Arkansas in Fort Smith, and we said, could we at least try, for the sake of our community, to help 100 families in crisis move all the way to career? And that's how 100 families. It wasn't a forever thing. It was just a 6 month to a year thing. And so the new components, back one, Bill, real quick. Here are the new components, right? You have to have a coalition. That's the alliance. And those coalitions, this follows the science of collective impact. That alliance is made up of players that can provide services, crisis to career. Hope ARK is our software system that we'll talk about a little bit. And then we had to have case managers. These are navigators, or we tried to call them, I forgot what, we came up with a slick name and no one knew what it was. So we just went back to case manager. But the case manager serves at a point of contact. They're in court, they're in child welfare office, they're in a probation office, they're in a family shelter, they're in a jail. And we've got case managers in the various communities in all those places. That's where our target clientele are gathered and where we can offer them an out. So working with the judges or the folks with discretion, we work with them and then offer people assistance. And so these case managers are responsible primarily not for delivering direct service, but the connection to the coalition members and building what we call a care team in our online collaborative case management system. All right, this is a picture of Hope ARK. This is actually a picture of, we just rolled out a learning management system where we have a lot of providers, and many of those providers in the state are doing case management work, so that connection work. And so we had to be able to actually do some real case management training, because it's different when you're doing a collaborative environment than necessarily doing it within one organization. The way that we put that coalition together is we have what we call a declaration of participation. It's got some visionary language, and then a we will do these things together, and we have a big signing ceremony. And everyone will use the collaborative case management system, which is fully HIPAA, FERPA, and COPA compliant, to be able to communicate on behalf of the client. Client gets to, in their disclosures, they get to say whether or not they want their information shared with everyone, or they'll mark out some people. So we protect their privacy and right to, it's their life. They get to be in the driver's seat. And so we rolled out in 2019 in Sebastian County at the 2-year mark. Of course, pandemic had hit, but at the 2-year mark, one of the pleasant outcomes was that reunification at that time had moved. If we take a child into foster care in Arkansas, 42% of the time does that child go back. So they're probably not going to go back home, but it was over 80% in the first 2 years, and over 1,000 children in Sebastian County had actually had protective services cases, or they were in a family homeless shelter. And so then it became, in talking with the governor, we said, we finally have one. It's our minimum viable product. This is what we've been working for all these years. And he said, well, maybe it only works in one location, but let's see if it'll scale. And so then we launched, in 2020, we launched 3 more counties, and they're all quite different demographically and situationally. And reunification rates in year 1 were all above 70%. And in our latest measurement of the trailing 12 months, we were 84% reunification rate, 89% if you include kin. So they didn't go back to mom, but they might have gone to grandma or some other blood relative that the child knew. Those are some of the outcomes. But most of our clients that are being served now in 6 counties, we've launched an affiliate program where we're teaching others to use the software and how to be the backbone in their own community. This is a big deal. So bringing that alliance together on a monthly or bi-monthly basis, we always show, here's the number of, we're serving 220 families collectively that are active right now. And here's the top end line is some of those 13 areas that are embedded in the assessment and software. And 66% were unemployed with no source of income when we met them. And then at the end of each month, one of the things that case managers do is they update the assessment. And we had, during this time period for this group of clients, that had been reduced to 23%. Housing's another big one. So on the far right side, we 20% met the homeless definition at that time and in that location. And that had been reduced to 2% at the time that we had pulled this. Being able to show your alliance data has been so important, so that they can see where we're winning and where we're not. The winning's important for confidence and willingness to participate and continue to bring others into the coalition. And the failings are the places that you can put. We have committees in each alliance, and they'll start digging into what are we going to do about this.